Okay, up next, our next speaker is Dr. Monica Daibert-Nido. Dr. Daibert-Nido is an ophthalmologist and clinician investigator at UHN's Donald K. Johnson Eye Institute. She's passionate about helping people with low vision to regain their sight. And outside the clinic, she recently discovered her love for skiing thanks to her daughter, Monica. You're up next. Thank you.
Good evening, everyone. Thank you for being here. So I'm going to start with a story of a patient. This is a 4-year-old girl who had strabismus. This is a condition where the eyes are misaligned or crossed. So as you know, she had to wear glasses since 1-year-old. For example, in her case, she had to patch the other eye, not to have lazy eye, and she got surgery for correction. So who knows here this patient? Do you think you know her? You met her today. You just met her. This is me. Okay, so I went through this, and going from office to office of ophthalmologists all the time, I developed a passion for the field, and I became myself an ophthalmologist, dedicating for 25 years now to eye care. So here at the Donald K. Johnson Eye Institute, I found an incredible environment. It integrates the best scientists and tools, and it's revolutionizing the way we treat low vision rehabilitation. So what is low vision, my specialty? Low vision is a condition where the vision cannot be corrected or fully corrected by glasses, standard glasses, eye drops, or even surgeries. So when you go blind, totally blind, your field is dark, you don't see anything. But if you have low vision, certain parts of your field goes blurred and other parts not. So this is on the left, on your left, a picture that shows how a patient with low vision can see the world. This is a patient with a central vision loss that could be macular degeneration, in certain cases glaucoma, or many other eye conditions. So as you notice, the central part of the picture is blurred, but the periphery is clearer. The explanation is on the right picture, where we have a picture of the retina, the light-sensitive part of the eye, taken with a microperimeter, this device that we use in low vision rehabilitation, at least in modern low vision. So this picture tells us where the patients can see better. The lighter areas are the areas where the retinal sensitivity is greater. But the black area is the area that cannot be restituted by medicine. So we must use the green area, or the best sensitivity areas in the eye, to help the patient substituting the vision that was lost. And this is my research. So my research uses biofeedback training. What is this? Biofeedback training trains the brain to see better, to see in another way. It gives the brain some sensory input, light and sound, to guide the eye movements. So we give some information to the patient about the eye position, and they learn how to focus using the green area of the retina that you saw in the other picture. Eventually, after training, for example, 5 sessions of 20 minutes, they start using this out of the training sessions in real life and started seeing a little bit sharper. So we use the microperimeter, this device on your left, and virtual reality now that we are researching on the right to deliver this biofeedback training. This is a virtual environment that we are developing for our experimental sessions. Sorry. So the patients, they have to track, I know you can't hear it, but the patients, they need to track the green ball using the better eye position. So we are developing the virtual reality so they will be able to take home the headset and train sitting on the couch, for example. Yes, now it's playing. So the patients follow the ball while a beeping sound gets more frequent as they use the correct eye position to see better. Okay, so we apply a series of tests to measure in our research how much the patients are improving from this technology. For example, we measure distance vision and near vision with letter charts. We measure fixation stability with the microperimeter, that device that I showed you before, to see if the eyes are wandering or if they are getting more stable and steady to see better. And we measure the retinal sensitivity to see if the area that they see is getting lighter or greener. So in our last study, we analyzed 347 patients. 80% of them had some sort of improvement. So they had 10 to 30% of improvement in letters vision, which means seeing 1 to 3 lines better in this chart, in this ETDRS chart. What does it mean? So the questionnaire of quality of life showed the patients would read better, they would walk around, groom, what else, cooking, everything they did better according to the questionnaires that measured that. And the best thing, these improvements lasted for more than 2 years according to our measures. For children, it's hard to overstate the benefits, the impact from these benefits. The parental questionnaire showed they could play sports, read, see the chalkboard, and many children grew up and got a driver's license. That would be impossible before training. So we are the first center in North America to treat with biofeedback training low vision. When I was a child, we didn't have a wealth of technologies to treat eyes or the vision, but our team is working hard to change that. We are working to prove the effectiveness of biofeedback training. And recently, for example, I treated Nicole, this young lady who was 12. She had difficulty to read on a regular book, for example. She couldn't see the numbers of the rooms in a cruise. She couldn't do karate properly and many other activities. She improved so much that she said, it's like a light switch turned on. And her father wrote me an email celebrating all these, and it was a revolution in her life. Like Nicole, there are so many other patients, so many other children who improved with this technology, and we need to move forward, researching virtual reality for delivering this and much more. So I remember when I think about Nicole, I think as myself as a kid, and how science is allowing us to do so much more for our patients. Thank you.
Thank you, Monica. It's really quite incredible when you think about it, because there's no surgery involved in this, right? There are no drugs. No, and just through this biofeedback.
Yes, non-invasive.
Yeah, I mean, you're able to help these patients with low vision. So what's actually involved in a biofeedback session?
The patient sits in front of the machine, or in the future using a headset of VR, and looks at a circle. Then a beep starts to play. As they move their eyes, the beep changes the frequency. They have to play like a game to make the beep gets more frequent and a long beep. When it happens, this is the right position to see better. They try to repeat this for 20 minutes, and it's done 5 times a week, well, 5 times in total every week. And
so in 5 times, you often see a significant difference?
Even the first time, some patients can reproduce the movement, and they say, oh, I see your face sharper right now. They find it incredible. But the 5 times or 8 times we're studying now is to consolidate so the brain can remember the correct position to see better.
And no side effects from this?
No side effects so far,
Yeah.
none.
Wow. Amazing, amazing. Thank you.
Thank you.
Thank you. Monica Daibert-Nido.